Hello, everybody. I'm Demi Vaughn for the Power of the Patient Project. We are joined today with Stephanie Payne for a second interview. Stephanie is an author, advocate, and retired hospice nurse. She's the author of The Sandbox Wars, a book that addresses the decisions that need to be made at the end of life. There are many issues that arise when that time comes with a loved one, and Stephanie offers advice and guidelines on how to make the experience easier for the surrogate who is making the decisions for the loved one who can no longer make them for themselves. Welcome back, Stephanie.
Well, thanks, Jemmy. It's great to be back with you.
It's great to have you. So today we're going to be talking a lot about Medicare and home health. So to kick off the first up question, who is eligible for home health?
That is the most important question because there's a whole book. It's about, I don't know, if you remember what phone books look like, it's about as big as a phone book. There's a whole phone book of rules and regulations on the Medicare guidelines, and certainly I've read a lot of them. But the home care benefit is kind of like a hidden benefit that a lot of people are not familiar with. You can't just call your doctor and say, send me out a nurse or a therapist. You have to, there's certain guidelines. And there's a lot of caveats that because we have these Advantage Medicare programs, and there's other, and actually regular health insurance almost always have a home care benefit, but there's guidelines to it. First, one of the most important ones is you have to be what they call homebound. And that would qualify with such things like you have a really hard time getting even down 1 or 2 steps to get out your front door. It might take 2 people or an additional person to get you out of the home. Of course, if you have a really bad infection, an open wound, that would probably prohibit people from leaving the home and being homebound. Like I've taken care of lots of people with open sores and they really should not be going to the grocery store, foot ulcers and such like that. And they, most of the time, a lot of times they guide if they can qualify for a nurse or a therapist to come into the home, they have to have a caregiver, at least somebody that can do with that, some of the housekeeping and the food preparation. So they have to be safe at home. But they are okay to be at home. They just have to be safe at home. They have to be able to get to the bathroom, and get a meal prepped, whether it's by themselves or a caregiver. So the nurse that would come in, or sometimes a therapist, physical therapist that would come in, they would assess and evaluate, the bottom line, is the patient safe at home so that the staff of the home care agency can come in and provide the care that's needed.
What is what is the difference between home health and home care?
Well, this is a big leap. So people that have home health, those are usually under the Medicare guidelines, which is defined as the Medicare home health benefit is a short-term benefit. They run in certification periods. Usually the first certification period is, I believe, 6 weeks, and the second certification would be 4 weeks. And sometimes they can recertify, for additional weeks, but it's time limited. And you have to show, in order to stay on the home health benefit, you have to show progress or some exacerbation of a medical condition that would require ongoing nursing or therapy visits, things like that. The home health visit, the home care visit, is related to usually the Medicaid benefit, which is completely different. It's a wonderful benefit that I spend a lot of time with patients in that benefit. They don't have to have that homebound status, but they have to have a lot of difficulty with what they call activities of daily living, which are, bathing, shopping, eating, getting dressed, taking a bath, things like that. And if they have deficits in those areas, under the Medicaid benefit in most states, they can get like a chore worker that would come in a number of hours a week, and that's usually capped at, I think it's up to 6 hours a day. And they would provide personal care services, meal prep, housekeeping, some shopping. Some of the agencies now even let the home caregivers even drive the patients to, like doctor visits and such like that. So they're completely separate. And so a Medicaid patient would oftentimes have Medicare and sometimes have home health visits, but when that ran out, the home care would restart or be initiated if they felt the patient could stay at home and just need some little bit of assistance, but they no longer need the expert nursing and physical therapy care. pretty
So,
complicated. Yeah.
yeah. So how does a person qualify for home health benefits?
Well, the home health is under Medicare, and most of the time it's triggered by an event meaning hospitalization. And you can't, like I said, you can't just call your doctor and say send out a nurse. Usually, you'd go to the doctor, they'd find something that's pretty serious. If a lot of times they get home health after a hospitalization, they've had newly diagnosed brittle diabetes, obviously wounds, heart conditions that are unstable, with really bad blood pressures and fragile heart conditions. A lot of post-surgery events like hip and knees, hip replacements, fractures, knee replacements. People are on new medications like that. So they would, get a nursing visit and a lot of times get physical therapy. So those are the things that trigger home health. I mean, there's been a few times that I've had doctors, well, I guess a lot of times I've had doctors call and say, please go visit Mrs. So-and-so. She needs a checkup, and, more than likely they'd end up in the hospital or something, more serious because they couldn't get in. They neglect themselves. I had a lot of patients that just, had some pretty horrendous events that I would, walk into. So it's usually triggered by some event. Now, another important part of the Medicare benefit that wraps around the home health benefit is the nursing home, the skilled nursing home benefit. And that's a really important event because most of the time, most people don't stay in the hospital that long. They get you in and out. It's like drive-through. You're in and out in a day or two. Oh, one of my scariest patients I had years ago, she was an elderly woman. She had a double mastectomy, and they sent her home, not even with an overnight stay. And it was just so the nurses came in, I think they're a little more cautious now, I hope. But anyway, so a lot of times people they're not good enough to go home. They need, wound care twice a day, or they're not safe at home, that evaluation thing where they can't, walk down the hall, get upstairs. So they would send them to a nursing home. And this is, once again, a limited benefit. It usually has I believe most of the time it's a 30-day certification that they get, all kinds of services in the it's usually nursing homes have a Medicare wing. It's more intensive, a higher staff ratio where they have, specialized, the nurses aides are trained to, walk patients and teach them a little bit. And then the physical therapy, occupational therapy, and then of course the nursing care that would be required. And they get their vital signs done regularly. They're checking their blood sugars if they're diabetic, and they're doing the wound care, and of course they're doing the therapy, visits as needed. And that's, and they really monitor that very closely. Nursing homes get paid huge sums of money to manage these patients and get them home. The whole idea is to not have to admit them for a permanent status if possible. And I know that I've had lots of patients, a lot of times they will recertify inside the nursing home for an initial short period of time, just a few more weeks if they're making progress and they look like they'll be able to go home, but they just need a little bit more care. So that's a wonderful, but the other thing that people they think that Medicare pays for nursing home care. That is completely false. And that's a really important takeaway from this conversation. Medicare will cover this 30-day intensive nursing home care for rehabilitation and medication management and diet management and stuff like that. But once that's done, then it becomes a private pay. And that's where I always tell people, this is the time to get motivated to get better. I've had lots and lots of patients, this is the time to do the therapy, get up and walk, learn how to, check your own blood sugar, learn how to change your wounds and your dressing care. So it's a really, really important, event. And it's a wonderful benefit of the Medicare program. And just a caveat here is that these Medicare Advantage programs, they have to provide the same amount of care that Medicare provides, but they do it in a little different way. So I can't, address all of those, in a conversation like this, but it is still, they have to provide the Medicare nursing home provision as well as the home care provision. So and they all go hand in hand. And then a lot of times people will spend this, let's say 30 days in a nursing home and progress pretty well, and they need to go home. The staff thinks that they're ready to go home, and they would send them home to more home health, where the home health nurses would then make sure that they were safe, and if they had stairs in the home, how do they get food, and then can they still manage themselves? And then of course, I always leave out, I don't mean to, there's a lot of social service provided in all of the Medicare and nursing home. They're always establishing that the patient is capable of taking care of themselves. They do a psychosocial evaluation as well as an environmental evaluation. Can the patient, once again, take a bath, get meals, get food in the house, light housekeeping and things like that. So it's a great benefit, and people, and you'd be surprised how many people use this. It's a wonderful benefit.
Yeah, and you had mentioned some of the services of home health under Medicare a little bit and previously, but are there any other services that are provided under Medicare with home health?
Oh, let me think. Well, there's, of course, nursing. There would be physical therapy. I always divide, if people don't understand, physical therapy is oftentimes, I describe it when I'm educating patients, kind of from the waist down. Can you get up and walk, move around, and then the occupational therapy is like from the waist up. Can you, comb your hair, brush your teeth, prepare a meal, things like that. So that's how occupational therapy is often involved. Social service, like I said, is really important. They come in and evaluate, family dynamics, home safety, financial. They have to do financial evaluations. Can they manage paying their bills? Are they capable of writing checks? Or nowadays everything's on the internet. A lot of senior citizens still don't do a lot of that. But so what else would be? And then, well, I don't think it would be in the hospice benefit, which we can talk about in a minute, where they would have a chaplain service and like that. So.
Yeah, we can definitely talk about the hospice benefit basics and everything underneath that realm.
Yeah, so the hospice benefit is part of the Medicare benefit, and it's also part of all of the Advantage programs that, once again, they have to provide the same level of care as the Medicare, that big book I was talking about earlier. They have to provide the same quality of care under the hospice benefit. And I also know that a lot of private insurance companies also cover the hospice benefit, and it's usually very similar. And what the thing about it is, and there's different levels of hospice care. There's palliative care, and then there's, hospice. When you sign on to hospice care, generally you're signing on to not have any more extensive treatment for whatever ailment is causing, the end of life. Cancer treatments will often stop, just all kinds of stuff. I want to put this in there because there was a survey that came out a long time ago that I thought was quite impressive, because I did lots and lots of hospice care in my day. And the one complaint that people had about hospice, I bet you won't guess what it is. The biggest complaint people had about hospice, and this was across the board, is they wish they'd started the service sooner, because it is so extraordinary. People tell me, I didn't know I would get this much care, this much love, from all the staff, all the support that they get from the hospice, agency. And they always said, I wish I'd done this 6 or 8 weeks ago. I didn't know it would be so wonderful. And inside of that response is that people often do pretty good under hospice. They because they feel more relaxed and comfortable about the end of their life, sometimes they hang on for a little bit, and it actually gives them time to resolve their life, if that happens. And I can't tell you how many times the family finally decides to put the person on hospice, and literally they die within 24, 48 hours. And that's so that's when that answer said, gee, I wish we decided this a long time ago, several months ago, that because under the hospice benefit, it has kind of a little different focus. Of course, it's the end of life, that you always have nursing. And what's really important is you'd always have most of the time have a nurse's aide would come out and help with bathing, and they're time limited. And you also have the nurse's aide under the home health benefit as well. They're time limited visits. They come out for about an hour, do bathing. Sometimes they can help with a meal prep. They're not there for long periods of time. They're there for a limit, just like the nurses and such. And you don't usually get physical therapy under the hospice benefit, but you get chaplain service, social service, and sometimes there'll be a volunteer to come out with support. And the one thing about hospice is that if a patient is signed on to hospice, they have to have someone in the home to assist. You can't have a hospice patient unattended because of a lot of medications are going on at this time sometimes. So it's a wonderful benefit. And as a nurse, the worst part about hospice care is going out at 3 o'clock in the morning and being to be with a family, which is always I always enjoyed those visits, but they were kind of hard on me physically, getting up and then having to go to work the next day as well. So some really long days in that respect, but it was very pleasurable to do hospice care. And you really feel like a nurse when you do it. You get to help manage medicines and do like real physical care, and do lots and lots of education. I wrote a book about it, of course, and it's amazing what a benefit is. So don't put off getting on hospice care if you think you're at the end of your life and you want some really good support. It's great.
Yeah, that's definitely important information to know. And it definitely sounds like being a hospice nurse has like a lot of responsibility and a lot of things that go into it. But so my final question for you, Stephanie, is what are the benefits of Medicaid?
Medicaid is usually a state-supported healthcare system. I know most states have Medicaid. It's when people don't have enough resources to have their own healthcare insurance, so they get onto the Medicaid benefit. And they have all the services that regular health insurance has. You have to oftentimes go to specific doctors and clinics to go to the Medicaid physicians. I do know that a lot of times under Medicaid, and this was kind of sad when I learned this, they do kind of limit some of their services sometimes. For instance, I had a patient, and this is not universal, and I'm not speaking for all situations, but I had a lady that was quite overweight, and she thought she wanted to have her knees replaced, and they wouldn't do it until she lost some weight. And because if you're obese and you have bad knees, it's not going to help your knees if you don't lose the weight. So a lot of people don't realize that the biggest cause of knees and hips deteriorating is excess weight on our bodies. So keep your weight down. According to the Medicaid benefit with home health, you don't have to be homebound. And it can go on for years. I had some Medicaid patients that I would visit in their home. I would usually just do an assessment with them, vital signs and blood sugar and such, and then set up their medications, and give a little education. Everybody always had a question about what they needed, something about their health, and I always made sure they had a doctor's appointment scheduled and follow-up labs and like that, just to kind of. And I found that my boss used to complain. She used to say, I said, have you ever noticed that my patients don't go to the hospital very often? And she said, yeah. She said, that's because I teach them something every time I go. I made sure they got their vaccinations, their medicines were refilled, they followed up with their labs and their doctors, and they usually did really well. So.
Yeah, well, all of the information that we've talked about in this interview is extremely important. I'm thankful I was able to interview you today, Stephanie. Before we conclude the interview, is there anything else that you would like to add about Medicaid, Medicare, home health?
Let me look at my little notes here let me just glance at these, because I wrote a bunch of notes down, and I'm going to make sure I got them all. Well, I think I did pretty good. Yeah, I did. Okay. There's a lot. Remember, these books are huge, and I try to condense it into 24 minutes. So,
right.
And anybody who's listening, always, the rules and regulations can change at any time. From my knowledge, they're basically the same as what they were, years ago when I was actively nursing. I have a neighbor right now. He's on he's actually a working person, and he's home with a serious illness, and he's getting home health, which I'm really glad to see that home health benefit expanding rather than contracting, for the general population, because it's just a wonderful benefit. And always ask your healthcare provider. And the other thing I was thinking about is always the first question when you come up with a really complicated health problem like end of life or cancers and even diabetes. You should probably ask your healthcare, oftentimes it's managed by your insurance company, which is of course your Medicare or Medicaid, is to get a case manager. That's what I did as a case manager. We just know a lot. We know where all the rabbit holes are and which ones you need to go down to and which not. Because if you don't have somebody that's there to answer a lot of questions when you're having medical crisis, they often assign case managers to complicated patients while you're in the hospital, and that's followed through when you go home, either to the nursing home if you're doing that route to care, and then if you're going directly from home to the home health program, then you're going to have a case manager, and it's just the way to go, because we know how to navigate the system, and if we don't, we ask our bosses to answer those questions. I can't tell you how many times I called my boss up and said, we need this for the patient, and within a day or so it would get done. So the case management umbrella is a huge advantage to being inside of the Medicare and home health benefit. So I guess that's my last word. Ask for help.
Well, thank you, Stephanie. I appreciate it. Thank you so much for coming on to the Power of the Patient Project. We appreciate it so much, and I hope you have a wonderful day.
Well, thanks, Demi. It was great being with you again.
Thank you.